Welcome to the Health and Wellbeing Magazine podcast. Today I'm joined by Raluca, a trauma-informed therapist who works with individuals navigating chronic illness and medical trauma. Her compassionate approach blends somatic awareness, mindfulness, and evidence-based therapy to support healing from the inside out. Raluca, welcome and thank you very much for chatting with me today. I'm really looking forward to hearing more about your work and the ways you support people on such deeply personal journeys. I have a couple of questions. So the first one I wanted to ask you was, what exactly is biomagnetism?
Oh, hi Sam. Thank you so much for having me. I'm really happy to be here with you and a bit nervous also. This is very important to me and talking about biomagnetism is something of great importance for me. Biomagnetism is a technique developed by the Mexican doctor Isagoiz Duran back in the early 80s when he was working as a orthopedic surgeon in Mexico City. And he came across this method studying with his teacher, an American doctor called Richard Bröringmeyer. Bröringmeyer was back then the medical director for NASA, and he was dealing with astronauts who were coming back from space. And because of the prolonged absence of gravity, they were having some kind of imbalance in the body, and they were coming back with a shorter leg. Usually it was the right leg, but then of course they didn't have that many astronauts to check this one. But let's just say more for statistic purposes that this was the right leg usually. And Bröringmeyer was using one magnet. He gave the astronauts one magnet to wear on their pants pocket, and they saw some improvements. And Dr. Goiz Duran started from this information and developed what is now known as biomagnetic pair therapy, using a pair of magnets, using two magnets, realizing that the magic happens between the field these two magnets are actually developing. So he developed the method and developed also the methodology, scanning up to 300 points and discovering up to 300 points on the body, points that show some specific connection with regular symptoms and what we know as illnesses or typical diagnostics. Basically, this is how it started almost 40 years ago.
Wow, that's really fascinating. So how did you come across it?
Well, it was around 14, 15 years ago. I received this diagnostic. I received the news that I have an enlargement of my aorta, and they said the risk of rupturing is really high, and I need immediate surgery because of the diameter of and the shape of that aneurysm. And I said, no way we're doing that. There has to be another way. And apparently it was because biomagnetism is said to have an influence on the elasticity of the tissues. And for me, it worked. It backed down to millimeters in that time, almost 15 years ago. And I know it might not sound much, but you measure life in millimeters in certain conditions. And back then, there was no one in Romania who was practicing or teaching this. So I went out of my way to learn this, and here we are. This is what led to me learning about magnets and actually practicing.
Oh, wow, so it's from your own personal experience. So what would a session look like? How does it normally roll?
Well, the patient comes on fully clothed, lays on his or her back on a therapeutic table. Usually, it's a massage bed, The therapist is checking with the negative pole of the magnet, is checking different points on the client's body. And when the therapist finds an imbalance, you will see that the legs of the client will shift, and usually the right side of the body, remember the astronauts, the right side of the body will shrink or contract up to 2.5 centimeters. That's pretty visible. It kind of looks like that. And when that happens, the second magnet comes along and basically closes the circle. So let's say you have an imbalance in the right eye and you're using the black magnet to pinpoint it, then and you see the shortening on the right leg, then you use the red magnet, which is the positive pole of the magnet, to balance that. And the client needs to keep that position in order for depolarization to take place for up to 40-45 minutes. It depends on where in the world is the therapy going on, because it's a mathematic formula that dictates the length of the session. And you can place up to 13 pair of magnets on an adult body, medium size, medium height, with good results.
Wow, that's really interesting. So what would be the main benefits of doing this?
Being a non-invasive and more complementary technique, it is used to bring the body back into balance, because it impacts directly the biochemistry of the body, influencing what Gois used to call the normal energetic level, that is around a pH of 7.3. Anything that goes above that level will cause acidosis, and that will encourage actually the development of fungi and virus development, because these two are friends and kind of feed off each other. And anything that goes below the 7.3 normal energetic level mark will cause alkalinity, and that will bring inflammation in the body and help parasites and bacterium develop. So by controlling that, imagine what can be done if you're using the magnets as a protocol before going into surgery, for example, and coming into an important procedure with a bad health, or doing it after surgery in order to leave behind whatever you might have picked up during your stay in the hospital. Or you can also have a lot of benefits when it comes to pain management, especially for chronic cases where medicine has a specific level of toxicity. It helps also bring down and control the side effects of medication, especially long-term medication, and it helps recovery basically. And last but not least, it can intervene when it comes to serious conditions such as tumoral phenomenon, because Dr. Gois said cancer is a specific mix of certain pathogens that come together, and once you break that particular pattern, you have a better chance of recovery. Just to name a few. It's a long topic, it's a long discussion.
Well, it seems like it's got tons of benefits, so that's really amazing. Thank you very much for sharing that with me. Are there any caveats to the method?
There are, in fact, there are some, because magnets are known to bring down the life of batteries. So you don't want to place any magnet on a patient who has, for example, a pacemaker or a cochlear implant. Whatever uses batteries and it's installed in the body, you don't want to mess with that. There are ways to go around it, and specialized therapists will know how to deal with that, but that's the main caveat. Pregnancy also is a situation that you want to be particularly careful about. And in Mexico, they have a spectacular case where they were able to save an ectopic pregnancy by conducting it from the uterine tromps into the uterus where it was supposed to be, and it became a valid pregnancy, and that child was born. That is done using the negative point of the magnet. So when you're testing your client and using the magnet around the uterus, especially if the woman doesn't know she's pregnant, this might cause the egg to shift and might lead to losing that pregnancy. So that's a big caveat. And also on people with chronic illnesses and long-term medications such as levothyroxine for hypothyroidism, or medication for diabetes, or for thinning the blood, because the magnets work really fast. Usually it's one and done. At least for Dr. Koiz, it was one and done. It was one session to bring things into balance. You need to have that checked, and the doctor will really be there for you, checking your blood test results and all parameters to make sure that the medication is still the right in the right dosage for you.
Well, that all makes sense. I mean, being that they are magnets, all those things, it does make sense to me that you would have to be aware of those sort of, like if you have a cochlear implant, for example, or a pacemaker and things like that, it really does make sense.
They also need to be taken as far away as possible from laptops, from any kind of device having a battery, even from credit cards.
Credit cards.
The credit cards, it will wipe out the information on the credit card, and also on entry cards, those that you use in the hotels to check in.
Oh, that's really interesting. I never even thought about that, but it totally makes sense.
Yeah.
Well, thank you very much, Raluca, for sharing your insights and your warmth and wisdom with us today. Your work is a beautiful reminder that healing is possible when we feel safe, supported, and empowered. We wish you continued success in all that you do and look forward to following your journey as it unfolds. And for our listeners, if you want to find Raluca, you can have a look at her website, which is biomagnetism-romania.com. I hope you have a wonderful weekend.
All the best. Ciao.
Thank you. Bye.
Bye.